I'm Dr. Henal Shah, a psychiatrist from Nair Hospital, Mumbai, and talking a little bit on grief. Dear friends, the pandemic has been a difficult time for all of us. Life as we know it has changed. Many plans, actions of ours have come to a screeching halt. There is a new normal. Many have lost their jobs, don't have a job, or working from home. School and college buildings are empty. Children and adolescents are learning through the internet, on their mobiles or laptops, missing out on the growth and development that occurs by interacting, playing, and meeting people. Marriages, celebrations have all come to an end. These all are loss of our normality. But the most important and dreaded loss is the death of a near and dear one. With the second wave, these losses have left people mourning and grieving in numbers far larger than we ever imagined. We have experienced loss of loved ones, but however, this time it is different. It is different not only because of the numbers involved, it is different because currently, very often, the person who we have lost unfortunately was hospitalized and was alone. The family could not be with that person in the last moment. Every culture has a process of dying and grieving, but all those rituals this time were suspended or done in a different way. This prevents the closure of death and accepting it and moving on. And therefore, our grief somehow gets suspended. For everybody, grief is a very personal experience and different for each one. It varies with the age and understanding of death. Children are different from adults with our prior experience of death. It also depends on our relationship to the person who's lost, how close we were, the circumstances of death, and how many people died in the one family. Currently, we know that sometimes it's a cluster. How good the social support is, and how vulnerable the individual may be because they already have an history of mental illness, substance use, or any other stressors that may have occurred. Grief presents in many ways. The commonest is feeling sad, yearning for the person, poor sleep, loss of appetite, aches and pains, no enthusiasm to do anything. Some may experience crying, difficulty in concentration, palpitations, worrying. For others, there may be emotions of anger, agitation, betrayal, sadness, guilt, and the fear of one's own or other family members' death. Grief impacts our thinking, decreasing our concentration, keeping us preoccupied with thoughts of the missed one, looking for answers and finding it difficult to solve problems and make decisions of everyday life. Sometimes we may have self-destructive thoughts and difficulty in remembering. We may withdraw, become angry and aggressive in our relationship with others. The experience of grief is not linear. It's like a roller coaster ride. There are ups and downs. One day may be terrible, and the other day you may find smiling at yourself. Accept it. This is how grief is. In children, it may look different. It depends on the development age and understanding. When they're less than 2, the death of a primary person is felt as a loss of security and well-being. Surroundings are not familiar and children become excessively cranky, crying, rocking, whining, biting. They may not be able to process death except for feeling separated from their loved ones. By the time they're older, between 2 to 5 years, many have feelings of anxiety, sadness, insecurity, anger. But for them, death is a temporary loss, thinking that one day it will turn back. And some children may act as if nothing happened, while others may regress and become passing urine and stools in unwanted places. When the child is between 6 to 9 years old, they can now start understand that death is permanent. They start getting worried and they worry about the other parent. They feel insecure, may become hyperactive, aggressive, disruptive. Sleep may become a problem with nightmares. As they grow older, between 9 to 12 years, they understand that death is final and that it can happen to everyone. They want continuity, and it is very important for them to play instead of just talk. They have a strong need to control their feelings at the same time, finding it very difficult to do so. As an adolescent, they may grieve for years. They want to take control of their emotions and they may end up taking risk taking behaviors, being reckless, alcohol use, or defiant. They may become distracted, sleep appetite and mood changes may occur. So there is a plethora of ways where grief may happen, both in children and adults. If you're grieving, how do you help yourself? Remember, there is no quick fix solution and not that one size fits all, but a few tips that may help out. First and foremost is to accept our emotions or thoughts, and that is okay to feel that way. The more we bottle up our emotions or thoughts, the worse it gets, and one day it erupts in forms that is unaccepting. So own up to your emotions and thoughts. Second, look for companionship. It's a time for social distancing, not for losing social connections. Virtually, there are many ways of connecting. Find solace in rituals by having them on a virtual platform. Reach out, talk to people. Mind and body are intimately connected. Look after yourself physically. Eat, sleep, don't skip your meals, don't indulge in substances which can cause problems. Do small things that can get enjoyment. It may feel stupid or it may cause anger or guilt that you have to enjoy. But looking after your mental health is equally important. Remember, there are many things that are wrong in the world and we can't fix all. Concentrate or focus on what we can do rather than fretting and worrying about things which are not in your control. Practice self-compassion. In our mind, we are always saying things to ourselves. Just imagine if you were saying those things to your friend or your sibling. Would it be right? If it isn't right, then it isn't right for you either. Stop that self-talk which is talking poorly about you and making you feel guilty or angry. For many, art is a great release. Indulge in whatever form of art that works for you. For some, writing or journaling is cathartic. It facilitates venting of emotions and allows us to reflect. For many, faith, spirituality, and religion is a source of comfort. A long way to experience grief. It is a process, not an event or a step. And therefore, don't be afraid of the pain. Only when we acknowledge our feelings and the basic response, more likely that we will ride over those bumpy hills and feel better. Accept the emotions, be able to face them and come out stronger and more resilient. Another point to remember, while there is finality in death and we have lost the physical presence of that person, we yet have a relationship with the deceased and which has not ended. And we should celebrate what we have shared together, the life we have lived, and enjoy those special moments. Grief helps us to accept the finality and adjust to a new normal where the loved one is no longer there physically. Sometimes it is our friend or our family member who has lost somebody they love. And how do we help them to overcome this grief? Very important, first and foremost, be there for that person. Accept him or her for her emotions, feelings, and thought. Don't try to fix it. Don't say it will go away, time is the only thing. These platitudes can be irritating. Let people be. People who are grieving can go through a range of emotions, and trying to challenge it will sometimes lead to anger and guilt. Keep it simple, listen, support, and check in frequently. Grief can come in phases and it may come a little later, so keep checking in. Offer practical help, meals, looking after the children, buying grocery. For children, remember to be honest and ask what the child wants to know. Allow the child to see your emotions and tears. Do not try to fix the child. They also need to go through the process on their own terms. Allow them to experience death if appropriate and warranted. Maintain a regular routine. Try not to expect more than they can give. Give them the opportunity to say goodbye. Use concrete terms and use a language that the child will listen. Do not make promises that are out of your control. But most important of all, listen. We worry. I don't know whether to talk. I may not say the right thing. More importantly, just let them know you're there for them. They won't talk about it. You don't make the choice. Be there and let them make the choice. I might upset them. Well, they're already upset and it's okay to be upset. We need to keep children busy. Not necessarily. Not thinking about grief is just delaying grief. Let's hide everything about that loved person. Remove the photographs. Remove anything that can be a memory. This sends a message that it's not okay to think about the person who died. Don't do that. I won't talk about it unless they do. The child will wonder whether there is something bad about talking, and they will realize that you're not uncomfortable. Be comfortable, be open, and ready to talk if the child wants. Once the child has experienced some emotion of anger or guilt, that's the end of the grief. It may come again in different forms and different ways. Grief is circular. It is easy to say passed away. Don't use euphemisms and phrases that will confuse the child. Keep it simple in the language they understand, but let it be clear. Don't be under the mistaken impression if children don't show emotion, they are not grieving. They may not show emotion. They may take the cues from the adults around them, but they're definitely grieving. A loss or death of a near and dear one will gradually help us to overcome our grief. And we come back to acceptance and back to our routine life, not forgetting the person, but integrating that grief with a normal life. For some people, it may not work this way, and grief may persist. And then they may have signs and symptoms of mental illness, such as experiencing sadness continuously, guilty, suicidal, indulging in alcohol or other substances. This may be complicated or prolonged grief. If any of this is happening, either in you or anybody you know, please consult a mental health professional. There are many helplines and virtual access to help. Reach out and get help. Grieving allows us to heal, to remember with love rather than pain. It is a sorting process. One by one, you let go of things that are gone and you mourn for them. One by one, You take hold of the things that have become a part of you and build again. Please look after yourself and invest in the health, both physical and mental, of yours and your family. Wishing you the best. Thank you.